Alright, so today we are going to demonstrate manual muscle testing, and before we begin, we're going to show you how to grade manual muscle testing. So you want to start out in an against gravity position to perform the range of motion. So you're going to ask the patient to perform the range of motion against gravity, and if they're able to partially or fully perform the range of motion, they will get a 3 or a fair. You then move them, if they're able to do this, you then move them to where they perform the range of motion with a moderate resistance added to it. If they're able to do this, then you get a 4 or a good. You then move them to being able to perform the range of motion with maximum resistance, and if they're able to perform this, they get a 5 or a normal. If they are not able to perform the motion partially or fully against gravity, then you take them to a gravity eliminated position and ask them to perform the motion. If they're able to do this partially or fully, then you give them a grade of 2 or poor. If they're unable to do this motion, then you move them to gravity eliminated and you ask them to do the motion again, and if they have no movement but a muscle contraction, then they get a grade of 1 or trace. And if they are unable to move and you do not feel a muscle contraction in the gravity eliminated position, then they get a grade of 0.
Today we will be demonstrating how to do manual muscle testing for external rotation. Have your client lie down prone with her shoulder abducted to 90 degrees. Make sure the humerus is in neutral 0 degrees rotation with the elbow flexed to 90 degrees. The forearm is neutral rotation hanging over the edge of the table perpendicular to the floor. The therapist stands in front of the supporting surface toward the side to be tested. The therapist will provide stabilization at the distal end of the humerus by placing a hand under the arm on the supporting surface to prevent shoulder abduction. The therapist will palpate the infraspinatus muscle just below the spine of the scapula on the body of the scapula. Or the therapist may palpate the teres minor along the axillary border of the scapula. The therapist will have the client rotate the humerus so that the back of the hand is moving toward the ceiling. She will palpate the muscles and observe the contraction. If the client is able to complete this motion, the therapist will provide resistance on the distal end of the forearm toward the floor in the direction of internal rotation. The therapist will apply resistance gently and slowly to prevent injury to the glenohumeral joint, which is inherently unstable. If your patient is unable to complete the motion against gravity, the therapist will have the client sit up to the edge of the table. The therapist will demonstrate how the patient needs to hold her arm. The therapist will also demonstrate the motion and ask the client to repeat the motion once she is there to stabilize. The therapist will stabilize the shoulder joint and the elbow, also while palpating the back of the shoulder. The therapist will ask the client to complete the external rotation motion with the gravity eliminated plane. If the therapist sees that the patient is unable to complete this motion, the therapist will palpate the back of the shoulder while the client tries to complete the motion to see if there is even any contraction in the shoulder joint. If there is contraction and no movement, they will get a grade of 1. If there is no contraction and no movement, the client will get a grade of 0. This was in the gravity eliminated plane. Today we will be demonstrating how to do manual muscle testing for shoulder internal rotation. We will complete this motion first against gravity. The therapist will ask the client to lie down prone with the shoulder abducted to 90 degrees. The humerus is in neutral rotation and the elbow is flexed to 90 degrees. A rolled towel may be placed under the humerus. The forearm should be perpendicular to the floor, and the therapist stands on the side to be tested just in front of the client's arm. The therapist will provide stabilization at the distal end of the humerus by placing a hand under the arm and on the supporting surface, as we did for external rotation. The therapist will then palpate the teres major and latissimus dorsi along the axillary border of the scapula toward the inferior angle. The therapist will then observe the client as she internally rotates the humerus, moving the palm of the hand upward toward the ceiling. If the client is able to complete this motion, the therapist may then test the client's ability to complete the motion against resistance. The therapist will provide continual resistance at the distal end of the volar surface of the forearm anteriorly toward external rotation. The therapist will ask the client to hold this motion as she resists. If she can fully complete range of motion against resistance, then she will get a grade of 4 against moderate resistance. If she can fully complete the motion against maximum resistance, she will get a grade of 5. If the client is unable to complete shoulder internal rotation against gravity, the therapist will have the client sit up to the edge of the table. The therapist will then demonstrate what she will have the client do. The client is seated with the shoulder adducted and in neutral rotation. The elbow flexed to 90 degrees with the forearm in neutral rotation. The therapist stands on the side to be tested. The therapist will provide stabilization on the arm at the distal end of the humerus against the trunk to prevent abduction and extension of the shoulder. The therapist will palpate the teres major and latissimus dorsi as described for the previous test. The therapist will observe the client moving the palm of the hand toward the chest while internally rotating the humerus. This is manual muscle testing for shoulder internal rotation in the gravity eliminated plane. If the client is able to complete this motion, then she will get a grade of 2. If the client is unable to complete the motion, but the therapist is able to palpate and feel a contraction, she will get a grade of 1. If there is no movement of the limb and there is no contraction in the joint, she will get a grade of 0.